Hello, dear friends. My name is Dr. Ayesha. I hope you are all doing well and taking care of your health. Today, I want to discuss a topic that many women feel anxious about but often do not talk about openly. It is about what happens after intercourse, especially when semen comes out of the body afterward. Many couples worry that this might reduce the chances of pregnancy or indicate a problem. Let me explain this in a clear and simple way. When a man ejaculates, the semen contains millions of sperm cells. A normal semen sample usually has around 20 million or more sperm per milliliter. This is a very large number, and only one healthy sperm is needed to fertilize an egg. After intercourse, it is very common for some of the semen to flow back out of the vagina. This happens because the vagina cannot store all the fluid inside. The body is not designed to hold the entire amount of semen, so some leakage is completely natural. This should not be a cause of concern. What is important to understand is that sperm cells are very small and active. Within minutes after ejaculation, many sperm begin to move through the cervix and into the uterus. Once they enter the cervical canal, they are no longer affected by the semen that may come out later. So even if you notice fluid coming out, it does not mean that all the sperm have been lost. For those trying to conceive, timing plays a very important role. You should track your menstrual cycle carefully. The fertile window usually falls between day 12 and day 22 of a regular cycle, with ovulation typically happening around the middle of this period. Having intercourse during these days increases the chances of pregnancy. After intercourse, it is often advised to lie down for about 20 to 30 minutes. This may help sperm movement, although it is not absolutely necessary. Pregnancy can still occur even if you do not follow this step strictly. Now, let's talk about another important point. If a woman experiences continuous watery or white discharge even the next day, or at times unrelated to intercourse, it may be a sign of vaginal discharge or an infection. This condition is sometimes associated with irritation, odor, or discomfort. In such cases, it is important to consult a qualified doctor for proper diagnosis and treatment. Maintaining good reproductive health is very important. Avoid self-medication, especially antibiotics, without medical advice. Incorrect use of medicines can sometimes make conditions worse instead of better. It is also essential to consider the male partner's health. A semen analysis can help check sperm count, movement motility, and shape morphology. If there are any issues in these factors, they can affect the chances of conception. Early testing can help identify and manage such concerns effectively. In addition to medical aspects, lifestyle factors also play a role. A balanced diet, proper sleep, reduced stress, and avoiding smoking or harmful substances can improve overall reproductive health for both partners. To summarize, the leakage of semen after intercourse is a normal and natural process. It does not usually prevent pregnancy. What matters most is the presence of healthy sperm and the correct timing during the fertile window. Do not feel worried or stressed about this common issue. Stay informed, take care of your health, and consult a doctor if you notice anything unusual. Thank you for your time and attention.